aim of theranostic was personalized treatment. The power of theranostic was giving more choice to the patients to participate in the process of care.
I think probably only about 5% of patients who could be or should be getting this innovative new therapy are actually getting it.
The whole idea of precision medicine or personalized medicine is around profiling a patient as a person.
I think that pharma needs to understand the complexities of creating a facility, of hiring the experts, including nuclear medicine technologists and physicians.
Empower the patients to meaningfully participate in the process of care.
Welcome back to the RX for Biotech podcast. In part one of this conversation with Drs. Babak Saboury and Dr. Eliot Siegel from United Theranostics, we talked about what it takes to develop and commercialize a radioligand therapy. In this second episode, we're shifting the focus to patients. You may have heard of the terms theranostics, precision medicines, and radioligand therapies and wonder what they actually mean. These emerging therapies are changing the way physicians diagnose and treat certain types of cancers. And in this conversation today, Dr. Saboury and Dr. Siegel explain in plain language exactly how radioligand therapies work and why many experts believe that these therapies could become one of the most important advances in oncology in the coming years. So whether you're a patient, a caregiver, or healthcare provider, I think you'll walk away with a much better understanding of why so many people are excited about theranostics and radioligand therapy. The next breakthrough in cancer care, of course, isn't just about discovering new therapies, it's about making sure that patients are aware of them and that they can access them. And that's exactly what this conversation is about. So let's get started.
The number of facilities that are actually able to provide this type of therapy is limited. And so if a patient is outside of a geographic area or is not able to travel and to spend time the next many weeks close to a particular center, then those patients really, unfortunately, practically are not able to take advantage of the therapy. So I really think it's a combination of, people at this point still are not as aware of this new and emerging and sort of exciting, innovative therapy, even the practitioners and the patients. And there are still very few centers out there that really have the ability to be able to do the diagnostic and therapeutic and dosimetry aspects of the therapy as recommended in the literature. And I think that's a combination. I think discussions such as this are making more patients aware, making more practitioners aware. And as time goes on, we're seeing more centers that are opening up. But I still believe that, there's an incredible amount of work to be done. And we're hoping to be able to open centers throughout the country. But we're really pleased to see many other practitioners that are also opening centers, not only in hospitals, but to a greater extent in outpatient environments also.
So to answer that, I can say the aim of theranostic was personalized treatment. The power of theranostic was giving more choice to the patients to participate in the process of care. So in order to have the best way forward, patients need to be more in charge of their destiny. Because at the end of the day, I strongly believe the best relation between a patient and a physician is the relation that is based on respect and based on bringing patient to the same level for participation in the process of care. That is very important point. And if you consider that one of the major problems that patients have is how we can find experts that we can trust. And that is one of the goals of United Theranostics. United Theranostics has the aim, and right now I can just confidently tell the clinical expertise and the people who are in United Theranostics are the best in the country. So this is arguably a very, very important and very important point to remember. In almost any other center, when patients are going, they don't know who are the people that are going to take care of them. Might be good, might not be good. But one thing that we say is that we put the quality and the highest level of care at the forefront. And all the physicians in United Theranostics, they are thought leaders and they are luminary nuclear oncologists. And these bring some peace of mind to the patients. They know when they are here, they are in the hands of the best.
So you mentioned earlier that pharmaceutical companies generally, their legacy way or their playbook for launching most products is, they're very physician focused. I think having pills that have like a 1 year shelf life that can be sitting in a warehouse for a year and not decay and so on, makes it makes the delivery of this therapy that much more complex. So you mentioned that there's a lot of new radiopharmaceutical products likely to launch in the coming months and years. I know there's a couple expected this year. What does site readiness look like, and what should they be doing differently to adequately prepare the market for launch?
Yeah, I think pharma needs to understand that it takes quite a few months or potentially even years to be able to find an outpatient facility, for example, to be able to prepare a hospital, to be able to add the additional space that's required to be able to treat patients and additional equipment that may be required. And I just think that pharma needs to, in addition to all of the dollars they've invested in these amazing, pioneering, innovative radiopharmaceuticals, I think there needs to be an understanding of trying to accelerate the infrastructure. I mean, building the coolest high technology futuristic cars is amazing, and putting all the dollars only into the cars is a challenge. One of the things that happened with Tesla, for example, was the idea of simultaneously investing in the infrastructure for charging throughout the US. And I think that put them at a really significant advantage, in addition to investment in AI, which we're doing as well. And so I think that pharma needs to understand the complexities of creating a facility, of hiring the experts, including nuclear medicine technologists and physicians, physicist support, and so many other things. And then all of the things related to being able to administratively order the radiopharmaceuticals, do the logistics, all the things related to reimbursement, which are complex. And I think pharma needs to understand that if the other infrastructure side of it is still relatively small, and yet the pipeline, even for some of the most promising radiopharmaceuticals, is there, the patients, we're still going to be at this 5%, to 10% range. And so one needs to invest on both sides, on that last mile of delivery side, and also on creating the radiopharmaceuticals and the logistics to deliver them. But pharma needs to understand that once they're delivered, that's only a part of it, and there's so much complexity after that. And working hand in hand with providers to be able to create that, I think would really be incredible investment from a financial and, of course, patient care perspective.
Yes, that is a very important point, because the complexities of radiopharmaceutical and nuclear oncology require a new and a fresh look. If old mentality and the paradigms that pharma traditionally worked on continue, they will be blindsided because they don't understand the immense complexity related to the care of the patient. And that results in two both unfortunate situations. One is just like ignoring the need for such a infrastructure, and the other is superficially simplifying the need and pushing toward the pseudo access, or what I call non-meaningful access. Both of them are hurting the entire ecosystem, because it's not only hurting the patients, it hurt pharma the same way. If you just like erode the trust of the community, nonetheless, everybody will be just like in not a good position. So one thing that we need to understand is that there is no easy way for excellency. It goes through the hard work, dedication, and expertise. And everybody should understand this is the way to go. If we think that these complex therapies can be given in a very simple situations and infrastructures, we don't see the reality as is. And I consider that one of the pitfalls of moving toward access, having maybe good intention, but not seeing the point, and result will be the pseudo access instead of meaningful access.
Can you give an example of what that might look like, Babak, when you talk about pseudo access?
So again, you can just like think about these radiopharmaceuticals. These radiopharmaceuticals principles inherently empowering patient or personalization of the care. Imagine that if you think you don't need to do dosimetry, imagine that you say, oh, dosimetry or personalization of care prevent expansion of the market. At first, it makes sense because you say, if I want to just like have more of that, let's make the burden less. Let's just like say you don't need it, but you don't know what you miss is the whole point. And that is optimizing the power of these modalities for the patients. That's one example that you can just like see. Again, you have short-term goal and long-term goal. This may, I'm not sure even for the short, may be a good strategy in a short time, but in a long run, nobody can endorse such a short-sightedness.
I think another point is that if you take a look at the number of sites that are listed as being theranostics capable, there's a mismatch as a patient as you're trying to actually schedule those and look through the logistics and find places that will allow a patient to be able to come in within a short period of time without a long waiting time for access. A lot of places that are theoretically doing theranostics treatments have very limited capacity as the number of diagnostic studies and therapeutic studies. So there's sort of, the idea of access and accessibility really being a mismatch, and hopefully that will change as time goes on. But I think when you're a patient and you are essentially confronted with cancer that can be treated with theranostics, the logistics of trying to find the right place to do it with the right people where you can get your diagnosis right away and therapeutic treatment right away, I think there's a much significantly smaller subset.
And other example that I can tell you is that majority of these imaging that you do in conjunction with the therapy is for the safety. And my simple question is that what is the value of the life? Sometimes pharma says that, oh, but you may just like save one life out of 1,000 if you do that. And the answer is that what is the real value of that life? If that 1% that it saved is one of your loved ones, do you dismiss the achievement as easy as you do when you're looking at that as a statistics? So again, the point is that people have different perspective. Pharma has the pharma job and physicians have the physician job. They look at the global scale and the macro scale. Physician job is just like taking care of the person that is in front of them, as if this person is the entire universe. And that is the difference in perspective. So we have this commitment to the patient that is in front of us at the time that we are dealing with them to say, I make all of my decisions as if the universe does not exist other than you. And I want to maximize your benefit.
I want to bring up again the whole, you both mentioned infrastructure several times. So I'm wondering, and we've also talked about logistics, and because this is a type of product that has to reach a patient within a few days for it to maintain its potency. Tell me about what would you think pharma should be thinking about around infrastructure layers, technology to help with that issue on the logistics side in particular?
I think one thing that would be really helpful would be an improvement in electronic exchange of information. And we mentioned that, we're doing clinical care and also clinical trials. I'm still amazed at the fact that so many systems are dependent upon phone calls and upon paper-based workflows, and be able to tie in to an electronic mechanism for delivery, communication of information about the radiopharmaceuticals and all of the timing logistics. It's just, as I've learned more about theranostics logistics, I'm realizing how much we're more in the Flintstone rather than in the Jetson era. We've done a lot of IT infrastructure within our own system where we've been able to write our own software to be able to do things digitally, to be able to track radiopharmaceuticals in the hot lab, and to be able to get a really good idea of what's going on within our own organization. The problem is that once we then take it to the next level with our pharmaceutical colleagues, there really is not a mechanism to be able to track that. There's no standardization from one system to the other, whether it's clinical care or clinical trials. Have you found that to be the case also?
Absolutely. So we need to bring the infrastructure to the 21st century. And
what specifically would you like to see pharma do to?
So again, I consider the comfort of the patient at the center again, and understanding that for patients, they may have some problem, they may not be able to come to the therapy, and exposing them to a huge number of dollars for the loss of the radiopharmaceutical, I think is not a fair thing for the patients, because again, they are dealing with a very daunting situation, and nobody wants to just like habitually not come to the treatment. There must be some dire situation over there, and not having a mechanism to take care of these humanly conditions is a very painful situation for the community. So I want pharma understands that at the end of the day, they provide modality for treatment of these patients, and we need to consider all of the surrounding conditions for these. So again, I hope one day by more integration between the clinic and the pharma for the distribution of these, we have a better way to coordinate the care and maybe just like not do the wasteful situations that we have at the moment.
As we wrap up today's show, I'm going to finish with one question I'd like you both to answer. It's kind of a fun blue sky kind of question, okay? So if you could snap your fingers and remove one primary barrier for referring providers, for patients, whoever it may be, what would that be, and what would be your approach to solving it?
That's an excellent question. I think the barrier really would be communication. That right now, when I see a new patient, I'm hearing a fax machine going off, and we get 300 or 400 pages of fax information. When we want to communicate back to referring physicians, whether they're in a hospital-based environment or part of a network that has its own portal or its own system, we really don't have good ways to be able to communicate. And so being able to cut across multiple different systems to be able to make it as easy as possible to be able to exchange information. No patient wants to come in and essentially have you take their entire history from scratch all over again. As we communicate information about our patients to our referring urology colleagues or medical oncology or other colleagues, being able to send that information electronically without having to, utilize paper, being able to take advantage of what everyone outside of healthcare is doing to communicate information, to index that information and make it available, being able to have access to patient prescription information, being able to have easy access to patient prior procedures. Patients frequently aren't even sure exactly what medications they're on or doses, especially, some of the ones who are on more complex therapy. And so for me, I would very much like to see that exchange of information enhanced, because I think if we were able to do that, we'd be able to bring theranostics to a lot more patients and make it much less, to significantly decrease the friction that we have as far as exchange of information. How about yourself? What would you like to see? Blue sky, if you could change.
So yes, so if I could just like have one dream, that was patients have more direct access to the information that they need and not receiving necessarily information through the other sources. So it's not that much far from happening. More and more technology advancement empower people to be in that situation. And I'm very, very optimistic about that.
I've had a few patients who've come to me where they've already done their research, whether it's on ChatGPT or Google, with a variety of different questions and information and ideas that they have. And, as Babak was mentioning, I think being able to tailor and personalize treatment for specific patients. Patients often ask about supplements. They have read about different sorts of offshore types of treatments. They're asking about combination therapies also. And so there's a new era of patients being able to have access to information and being able to allow them to be able to find and discover this cancer treatment of the future. Theranostics, I think, is something that I'd very much like to see more accessible to patients, as well as they're searching for care for themselves and care for their loved ones.
That is very true, because I truly believe in the power of the common sense. It's amazing when you see people and ordinary patients getting exposed to the real information, how good they participate, how good they make the decision. And this is maybe kind of unusual for the medical community, because there is more like a paternalistic approach that I I prescribe and I order, but I more and more realize how much participatory decision making makes sense. And many of our patients, they themselves say, I want dosimetry. I want to have more personalization. And that is to me a very, very important achievement.
The other thing that I would love to see would be some additional assistance with regard to some of the regulatory challenges that we have. And so at this point, they're still relatively rigid. For example, the therapy is prescribed currently at 200 millicuries of radiopharmaceutical for Lutathera and also Pluvicto, and being able to have a little bit more of flexibility with regard to patient and physician decisions. And I know we have patients who frequently come in and ask whether or not we can sort of put them on radiopharmaceuticals that would otherwise be on clinical trials for compassionate use, and being able to work more closely with a more flexible, adaptable, regulatory environment, I think would accelerate our ability to deliver safe and effective care for our patients as well, as long as there are, of course, logical constraints on all of those.
I love it. I mean, would love to continue talking to you both. This has been very enlightening, and I think you're right. I think as a theme, we are seeing patients be much more active and engaged in their care, and AI is only further accelerating that process. And you gave a lot of good insights, a lot of food for thought to those in our audience who are preparing to launch new radiopharmaceutical products. You've helped explain theranostics in plain language so patients can understand today. I appreciate you both being here on the show.
Yeah, thanks for making it fun for us, and thanks for really providing a platform for us to help to educate patients and colleagues. We really appreciate it. It was really an absolute pleasure.
Absolutely. It was a great pleasure, and thank you.
Thank you both. If you enjoyed this conversation, be sure to subscribe to the RX for Biotech podcast channel to hear directly from the leaders that are shaping the future of personalized medicines. And if you or someone you know is battling a health condition, visit therapyforme.ai to search for a specialist near you. Thanks for listening.